Welcome to myTRIAList Trial Talk, Voices of Experience.
I'm Shelitha Harris. I am 34 years old. I was diagnosed with stage 4 Hodgkin's lymphoma the second time.
Did your doctor play an active role in helping you find and choose a clinical trial?
I met Dr. Ahmed. She was the one that specialized out there in the lymphoma clinic, and they was like she's very good at her job. And so I met her. She was saying that I had two choices. She said, "I want to put you through a clinical trial." That was the second option. The first option was a standard trial, something that I already previously been through. And so I told her. She said, "Well, it's up to you." She said, "But I wouldn't suggest anything that I know wouldn't work." And so when she began to explain all those things to me, she made me feel so comfortable. And in that moment, I had never felt peace with someone until I met her. And when she explained to me that she wouldn't, allow me to go through something that she didn't believe would work, that was like her initial statement to me. I wouldn't put you through this. She said, I'm gonna get you have time. And the thing is, she didn't rush me into making my decision when she gave me the two options. But she said, I'm gonna let you think about it. And whenever the time comes, when we see each other again, well, I'm gonna call you back. And she said, even if you decide to stay in Louisiana, she said, I can look up some resources and then you want to drive so far. And she said, and the next place she had told me about was Baton Rouge. So I was like, well, it's closer for me to drive to Houston than it is to go away to Baton Rouge and do treatment or whatever. But she made me feel comfortable and she heard me out. And it's like you could tell she really cared about her patients and that she'd been doing this for a long time and she didn't rush me into anything.
How did you feel about clinical trials before enrolling in one?
Ooh, well, I was at first I thought I was gonna be a lab rat. If that's I know people say that because it was like I heard it was like not FDA approved, in which I didn't really know what federal something, but I know at the time I didn't know what that meant until I did my research, and it was like it's just saying it's not something that they normally would do, give patients, but they had a small percentage of people that they have used it on, and I thought maybe like my sister was thinking that I may have was getting the non-drug and see what it work on me and like they was giving it out to all these people. And so that was in my head about that. And I was like, okay, that is not what she said. I had to go back and remember what she said, recall that information because she not say I was gonna get the fake drug. I was gonna actually get the one that they was gonna be using towards me, helping me through the trial.
Why did you decide to enroll in a clinical trial?
I decided to take a leap of faith. I didn't know what I was getting myself into because they was telling me it's not FDA approved and all that stuff. And people also gave me the negative stuff because it's just the numbers and letters. There's not a name for it. And so I was like, okay, you know what? I went against the grain, I would say, because my family didn't want me to do that. But I decided to pray about it and I made the decision to go with the clinical trial.
What was the clinical trial enrollment process like?
I met a lady named Miss Grace, and she reached out to me and was telling me about the paperwork. My insurance had to approve it, and it took a while, maybe a week or two, for the insurance to approve the clinical trial. So I had to go through that, but then later on, maybe a week later, the insurance was like, okay, yeah, we're gonna go ahead and approve it for that. And so once the approval came, I had to go do some paperwork and the paperwork was just I had to go through with Grace, and I did it from my phone. And she said that you read all the different kind of side effects, how it affects your body, and stuff like that. And then once I did the paperwork, they went on ahead and made their first appointment for me to go to the different clinics. Clinical trial, I think my first biopsy was when they went in my chest in this area. They was like, we just need this because I think you can opt out of it, but it's my first time in the trial. I told her, okay, I'll go ahead and go through that biopsy, and I had to have one in the chest, and I have a second bone marrow biopsy. They had to go in the same, maybe another spot, but in the same area, and I had to go through like do like some stuff with my heart, EKG, pulmonary, like the breathing in and out the tube. So they had to get all this stuff because they want to make sure my heart was strong enough for me to start the clinical trial.
Did you face any barriers when deciding to enroll in the trial?
I'm a single woman with no kids, no support. And as a paraprofessional in Louisiana, you don't make much money. I don't know about in other states, but for me, I know it was a struggle financially because here I am, I need my job so I could have my insurance to pay for this the things that I couldn't cover because the insurance didn't cover everything. I was faced with a financial decision and either stay in Louisiana because of the fact that, oh, okay, I have Medicaid. I'm here, but Medicaid is not accepted out there. But if I want the best care, I feel like that this hospital, the MD Anderson can offer me, then I need to go with the best care. And then having a job and then not being able to work full time because I had to take a leave of absence.
Can you tell us about your clinical trial experience?
I would go like twice a month, every 2 weeks. They'll do the Benadryl, Tylenol, all that stuff before they give you the treatment. They gave all that through an IV in my hand, my arm, and then they would just draw blood because they had to do EKGs during the trial. And then they would also draw blood between the treatments. And so I would come drive down from Louisiana and I would check in the hotel. So, and then I would stay maybe 2 or 3 days because sometimes they had like doctor's appointments a day, like blood work a day or two before your actual treatment. So I would stay down there for like 3 or 4 days before I actually had the treatment. And so once I had the treatment, I would go back to the hotel and then I would check out the next day. Long because in the beginning they would want to make sure they keep an eye on you, once they have this like window of time where they monitor you. They treated me like royalty. I would say for myself, I was treated like royalty because I never got in the bed. I was laying in bed and they would just get like before that, I was just sit in a chair. But this time, here's your bed. Lay down, get comfortable. And I was like, wow, I feel good about this.
What was one thing you were surprised to learn about clinical trials that you didn't know?
I was surprised to know that it didn't have the effect on my body that chemotherapy or radiation would have. I didn't lose my hair. I did not. During the clinical trial at all, my hair actually like to me, my hair had grown longer. And so that's what really surprised me because I was like, am I gonna lose my hair? And they're like, no, it's a slight change. You will not lose your hair. And so I didn't even get skinny. Like if I was going through chemotherapy, all the weight that I thought I was gonna drop, because the first time I had cancer, I had dropped from a size 12 to an 8. The second time I was still like my weight was still consistent. And then all the stuff that happened to me the first time wasn't happening the second time. I went through the clinical trial and people would see me, it was like, you doing treatments and you look like that. I'm like, yeah, yeah, I'm on the clinical trial. It didn't affect me like chemotherapy would. So
How did your family, friends, and community react when you told them you were enrolling in a clinical trial?
my family, we don't see eye to eye on certain things. I would just say it like that because I'm a firm believer. I have faith. I believe in God. I'm a church going woman. I'm a praying woman, and I feel like they weren't there, and so they couldn't understand if this is what I'm supposed to do. Then you need to trust that. So they didn't trust the decision I was making because they was looking at me like it's a clinical trial. 100 people went through it. How do we know it's going to work? I said, that's the thing. Faith is the substance thing, hope for things. I say, I can't see it. So I just gotta believe that it's gonna work. I just have to trust that it's going to work for me. If I didn't pray and I feel good about the decision I made, then you have to trust me to know that I am making the best decision for my life. They didn't trust me until we got down the road. They was like, wow, you tell me 3 months in, the cancer in the that was localized, the part that was here in the chest area is going. The only thing we're working on now is the cancer in the abdomen and the cancer that's in the hips, I said, yes. See, that's how you trust the process. I'm in it and you're not in it, but you're my support system. Just trust me to know that I'm making the right decisions. And I also had other people that was there, like that not my immediate family. I had my church family. They was like, okay, we got your back. Whatever you need, we'll try to help you the best way we can. And so they of course they solicit their prayers, but they also said, we with you. Whatever you decide to do, if you decide to do this or that, we'll support you in that. So that I feel like having that support system, even if you decide to not go with the favorable decision, go with what you think is less likely that people will say, okay, you shouldn't do that. But if it's something that you feel strongly about and you have a strong conviction and you feel like, okay, I got peace with this decision, then that's the decision you should go with. And that's what I did for my life.
How did you take care of your mental health throughout the clinical trial process?
I tried to continue to keep my faith in God. And because it don't matter who you are, if you are a person going through this chemotherapy, clinical trial, being diagnosed with cancer, it shakes your faith. If you're a believer, if you believe in God, if you believe in Jesus Christ, it don't matter. It just shakes you up a little bit because at the point when I would go to the lymphoma clinic and they would have me check off these things concerning my mental health. And then for me, it was just being open and honest where I was with the whole situation. If I felt like I was like at the point of like I can't do this anymore, I need to vocalize that to my support, the people that had my back, and say, look, y'all, I'm going through and I'm not here. Like I'm ready to give up because going through that and then going through the clinical trial and then going through stem cell, it really took a toll on my body. And then during those times, I wanted to give up. But having a level, keeping that level of, okay, I know what the scripture says. I know I can make it. I got these people that's telling me they love me, and they gonna say, we right here for we praying for you. And then them calling me when I couldn't even call them myself because I was so it was almost like when you think you so strong, because people see you as a strong individual, and then you like, I'm not as strong as I say I am. I'm weak in this moment, and I need you guys to know this is where I am. So being realistic about where you are um in that moment, going through all that really helps you mentally. And this journal here is what I kept all everywhere I went. I would write in my journal, write about what I'm feeling, write about what I'm going through. Having that, even when you don't have anybody to talk to, having that avenue to get out of that mental stress, depression, and all that. I feel like that plays a part in having a stable, keeping your faith in all of it is help stabilize your mental capacity.
How has cancer care helped you?
So when I saw cancer care and I read up on it, and I was like, you know what, I'm gonna give him a try. And I called for myself and I spoke with somebody and it was like, okay, how can we help you? And the lady was so nice to me. And I explained her what I was going through. And she said, okay, I'm gonna send you some paperwork. And the stuff that I couldn't fill out on my own, I had to use the social worker. And the social worker pretty much, did her part. And I'm so thankful because I didn't know that all these things existed until came until I got in this situation that I was in. But before that, no one ever told me about cancer care, how they can help you and whatever you're going through if you're a young adult patient. Like for me being a young adult patient at the age of 34 that I am now, it was like we have resources for you that can help you even if you want to finish school. Because at the time I was in college, and I was like, I want to finish school. What I supposed to do? They was like, we have scholarships available to help you because I was even in my downtime, I just didn't want to sit there and be a couch potato. I wanted to continue to do something in my life. And so cancer care, when I got in, got a part of you guys, Cancer Foundation, it really helped me when I needed it the most.
What advice would you give someone who is having a hard time deciding to enroll in a clinical trial?
I would say that, you just have to make sure that you know your body, know yourself, know what you're capable of doing. Don't push yourself too hard because at the end of the day, you got one life. It's your life. Either you're gonna live it in fear or you're gonna live it trusting that you are making the right decisions and you have your faith in the master's hand and you know what you need to do for yourself.
Why were you let go from the clinical trial?
So by March or April, that's when the trial ended for me. And then because the doctor was like, okay, you've been on the trial for this long, because I missed some treatments, they was like, okay, you should have been further along than where you were. But it was because of the fact that I missed some treatments.
Was enrolling in a clinical trial the right decision for you?
Yes. The moment I realized it was when 3 months into the trial, it worked. Like, I don't even think chemotherapy, and I don't give all credit to whatever, but I just think that the clinical trial, being in it and actually stepping out on faith and trusting the process, I trusted that this was the best decision to make. And even though I got sick, I ended up with meningitis in going through that within 3 months. But it was the fact that they was like, okay, you got this and that going on. You don't need treatment right now. We're gonna go back and revisit, or we're gonna check on you. And so I came through that 3 month process with the cancer was like gone. And I was like in this part of my body. That was really like I was like, God, I see you working. You even work through medicine. I was like, you worked that out. And I was thinking that it's gonna be, even though it took me a year to go finish all this up, I haven't even been in remission a year. So it was like, okay, you went through it. Just trust that you made the right decision. And so I felt like in those moments when the doctor did because every 3 months you would do a PET scan. So every 3 months, when I had that PET scan in March, and she showed me, I think it was like March or April, she showed me that look is what look before, here's your after. I was like, wow, just 3 months of being on a clinical trial.